Normal blood pressure is traditionally defined as values below 120 millimeters of mercury. These are the higher, the systolic values, and 80 millimeters of mercury, which are the lower, the diastolic values. Anything above that is abnormal, defined as pre-hypertension or hypertension. It's surprising, but the damage or the proof that damage caused by hypertension can be avoided the proof has been in our hands not for a long time. It's only since the mid-60s that the first small trials proved definitely that extremely high blood pressures, if lowered, that if you lower extremely high blood pressure values, you prevent strokes and other complications of blood pressure. Prior to that, people said that blood pressures should physiologically increase as you age, and that nothing should be done to lower it because more damage is going to happen because of lowering blood pressure than the damage that happens with elevated blood pressures. So it was quite a revolution at that time that studies showed that high blood pressures and very high blood pressures are causing damage, and the damage could be prevented by lowering high blood pressure values. It should be noted that hypertension or high blood pressures are rarely symptomatic. That is, the patient very rarely complains of headaches, especially posterior headaches at the back of the head, or dizziness. Most sufferers from hypertension are asymptomatic. They have no complaints, and finding the hypertension in them is something that happens incidentally. They go to the doctor to have an anti-flu shot, and they have their blood pressure taken there, and oops, it's elevated. So it's not like a backache or some other disease that we feel. We feel nothing. So you can call it a silent killer, one of the silent killers, like hypercholesterolemia, like diabetes, etc. Hypertension is extremely prevalent in Western societies, and the main thing that you can do from the dietary point of view is to lower salt consumption. There is a lot of salt in our food when we buy bread and when we buy meat and in canned foods, etc. And on top of that, we add lots of salt to our diet. We sit at the table, and without even tasting the omelette or the salad, we spray them generously with the salt. This is something that I would avoid. At least taste the food. If you add salt, add the minimum amount of salt. Don't go into extreme. Don't take salt entirely out of your diet. But there is too much salt in Western diet as it is, and we should avoid the excess of salt that we use. This is the most important and very basic thing that we can do from the dietary point of view. Of course, smoking is very bad for everything, especially and also for your blood pressure. Overweight and sedentary lifestyle are bad. My advice in that respect is not different from general advice for healthy living. So salt, excess weight, sedentary lifestyle, and smoking are bad for you. I'm definitely for patient education by whatever means the patient feels comfortable with. If it's internet, Google, brochures from organizations, I'm all for that, and I'm for active patient's participation in his care. Informed patients are easier, are more cooperative, and the results you get with them are much better. But with the internet and with Google, there is one caveat. The caveat is that the information can be unreliable. So one has to pick the internet sites which belong to professional societies, usually different professional societies, and respected institutions like the NIH or other Israeli institutions are more reliable, and finding the information that you find there is reliable. Information coming from commercial sources, etc., has to be taken with a grain of salt. Don't eat the salt, but the information has to be taken with a grain of salt. Everybody would like to be 20 years old and blonde and with blue eyes, etc., etc. But if you've got hypertension and it's untreated, it's, as we said, it's a silent killer. You cannot afford not treating hypertension. You cannot afford doing it. So if you can overcome the hypertension by stopping smoking, losing 50 kilograms, starting to exercise, and decreasing your salt consumption, then good for you. But a large proportion of hypertensive patients suffer from what we call essential hypertension. That is a hypertension that we do not find an explanation for. And for these patients, there is really no other choice. They have to take a tablet or 2 tablets or even 3 tablets, or almost 3 tablets, as was found in the new studies that we discussed.